Welcome to the River Park Dental Show. This is Dr. Phing Saurer, and I'm here today with Michael Morris.
I think you should just say that like every week. Like I'll always be with you. So you don't have to like introduce me that I won't be here.
Well, I mean, I am here with you.
Technically, what you said is correct.
You might not be here one day.
Listen, I want to get into something that happened before we got on the air because I think this needs to be discussed. We talked about your background on the first show we did, and then I just found out you have not seen movies from the 80s. You didn't know who Anthony Michael Hall was.
One movie.
You said you...
Maybe two or
I know this
three.
is supposed to be about dental, but I'm very upset that we have to start the show this way, that you didn't know. Jim, what was the name of that movie?
16 Candles.
16 Candles.
Yeah.
I told her I got to see 16 Candles. You got to see Breakfast Club. Ferris Bueller's Day Off. Great movies.
And I think we need to explain to people listening that your maiden name is what?
I will not reveal that information.
Okay. All I'm going to say is it's related to the kid that comes over to stay with the family.
Dong.
Yes. Your maiden name is Dong.
My name is Ping. Ping Dong.
Yeah.
Was the name I grew up with.
Which is the greatest name of any person I've ever met. And then you had to ruin it and get married. But I said the name of the guy from the movie. And you looked at Jim and I like we had no idea. Like, are you just making that up? That's not even funny.
No, I've heard of it, but it's...
Okay, I just wanted to point out to the audience that while you are a very sweet person and very knowledgeable about dental things, you don't know movies. So
a couple 80s movies. Ask me any...
Who is Anthony Michael Hall and what's a movie he's been in other than 16 Candles?
Who cares?
That's my point. Now we're going to get right into the show. I just wanted people to understand, because we covered your background before, that you don't know some things.
Everyone's tuning out now.
Yeah. No, I bet you there are people right now writing emails to River Park Dental upset about this issue. I only had to say that because we just said that before the microphone came on, and I'm very upset with you. But we have something important to discuss today, other than movies.
Yes.
And I had mentioned to you a couple of days ago what we were going to talk about. There was an article in the New York Times about Medicare doesn't equal dental care, and that can be a long-term problem.
Yeah.
And the reason I bring this up is if you are the head of household or you have a family and you don't have dental insurance, that is going to be a long-term problem for you and your kids or your wife, whoever you're responsible for.
Right.
And you and I were kind of talking before we started that dental care is something that's not covered by insurance. Like you have to select it. So
Yes.
most people think they kind of already have it. So in some cases you don't. And then when you go to, if I came to see you and I don't realize I don't have dental care, my bill is going to be a lot higher than I expected, right?
Yeah.
So, but you need dental care, right? People
Yes.
need to
Yeah.
have something because is it recommended every six months?
Months you should get a cleaning.
So
and
if someone
exam.
like Rachel, who's sitting in the back of the room, who hasn't been to the dentist and she's 25 and hasn't been in 21 years, that's not good.
She probably has a lot of tartar.
That is why she's never on the show, because she doesn't open her mouth.
She doesn't want to show it. She doesn't want to show it. And
she
I
also
wouldn't want
doesn't
to
smile,
either.
and now I understand why. It's not because she's not friendly. It's because she needs to go to the dentist.
No, she is beautiful, and I doubt it. But yes, but you do want to do the 6-month check, just because if you don't, and then you wait 10 years, and then I don't know, you have pain, then it's a lot harder to fix that. So you may end up needing a root canal or extraction and stuff. So if you just come every 6 months, get the check, be more preventative about it, then the long-term costs probably aren't going to be as much.
How many people do you think in your career that you've seen that have not had dental insurance? I don't want to say they got upset after they got the bill, but they've put this off until they had massive pain. I mean, you probably get at least one a month where somebody said, I should have gone to the dentist in the last decade.
Yeah, no, I've gotten a lot that just, a lot of my patients, like I haven't seen it, and they, it's as long as they're in that chair now, it's just a good time to start. But yeah, there are a lot of people that haven't had it for 10 years, 5 years, a couple years they let slide by because they didn't have dental insurance. So
Well, that is the number one thing that I always hear is somebody didn't have insurance or they're between jobs, so they kind of put it off.
Right.
And then...
Well, I think a lot of people think of dentistry as elective. So it's kind of like, with medical, yeah, you need to get your checkup and stuff like that. But dental, well, it's just my teeth, so...
And they're not important. They only help you chew and digest food, right? So
right.
Other than that, we don't need it.
No. Yeah,
okay,
exactly.
Good. So we're in agreement. You could skip it for a decade and be fine?
Yeah, sure.
Okay.
No.
So when the issue of insurance, I know that Ellen handles that stuff.
Yeah.
But if somebody is thinks that they have insurance that covers dental, they need to check their policy, number one, right?
Right.
So if you don't have it, you had said this to me, even paying out of pocket is better off than if you don't have a savings plan at work. Paying out of pocket, it's still worth it because long term you could cause yourself more damage, which is going to be more expensive, especially if you don't have dental insurance, right?
Right. Well, and I think the only thing that, I mean, I remember Ellen telling me, because you're right, she is more knowledgeable about the insurance aspect of it, and the manager in my office. She says that, well, dental insurance is really not really an insurance. It's more like a benefit.
Right.
So it's like a discount. You're getting a discount, but you're paying into it, and then you get capped off at a max. So usually it's around 1,500, sometimes 1,000, or like I've rarely seen 2,000, but that's like a big max. But then once you hit that max, you're done. Whereas in medical insurance, it's like once you hit your deductible, then everything gets paid. So it's kind of the reverse of medical. And I don't think a lot of people know that. They just kind of.
Well, I think most people think dental and medical is the same thing, especially when they're doing their benefits.
No, we've gotten a lot of medical cards, and we're like, that's your medical card, not your dental. So then it's kind of like, they're like, oh, I thought this was the same.
Right. Well, what I thought was interesting in this article is that they're talking about Medicare in this example. So we'll break this down from the family perspective later, but 1 in 5 people 65 and older have untreated cavities. What's strange is the same proportion of those people have lost teeth or lost all their teeth because they thought Medicare covered their dental. And then when they get to the point where they need implants or dentures or partials, they're not putting the money into it.
Yeah. Well, so Medicare doesn't cover much either.
Right. But that's what I'm saying is the article is saying these people that are counting on Medicare, thinking that it's dental insurance, it doesn't cover that at all.
Right. Yeah. No. And it covers, I'm not really familiar with that, but it doesn't cover a lot. And then the thing that bothers me about that kind of stuff is that they won't even cover preventative things very well. So like,
what would that be?
If someone had pain and they need a root canal would save the tooth, but instead they'll cover an extraction. So then you end up having to extract that tooth. And
wait a minute, back up. So the insurance will say, listen, you could fix this, or you could just yank that thing out.
Yeah.
And the
patient's like, well, I don't want to pay this out of pocket.
So they'd rather have their mouth
They'd rather take a tooth out. Yeah. So when I worked in a Medicaid clinic, they would opt more for tooth extraction. This was right when I got out of school. So I became very proficient in tooth extractions because that's what they would pay for or choose, even though I gave them all the different options. But they kind of let the insurance dictate what they want to do, because that's all they can afford, which is, for me, it's hard to see because when you take a tooth out, it is more expensive to replace it later on. But
because you have your implant that you have to do, and that is, I know family members of mine that have had that, and the cost of just the one is so expensive. So you're kind of setting up. I've got to get this extracted, but you have to have something in place of it, right? Because you got to keep your spacing.
Well, they won't replace it right away. But what ends up happening is they'll get a lot of decay, and then they need more teeth taken out, and then they lose function. So then So this kind of leads into this whole different thing where they can't eat food, and then or they can't chew it very well, and then they swallow it, and then their digestion gets kind of funky, and then it becomes a whole body issue thing. So
you're kind of going off my premise of you need dental insurance to do the preventative stuff.
Preventative.
See, I like it. We would get on the same page. So when you say preventative, though, where does that start?
So, come in for regular checkups and cleaning. So that's where we take the x-rays, where we kind of look at everything, make sure cavities aren't forming, because if they're small enough, we can get them right away, put the fillings in, take care of them, and then just keep an eye out on anything developing. If you wait a long time, you may have a cavity that starts, and it may progress. It may take 5 years to progress, say. But you wait that long, and by the time you come in and you're like, I'm having pain, usually when you have pain, it's gotten to the point where there's a lot more that has to be done. Yeah. So then it's either root canal or extraction or, implant and then it gets costly. And then I think for people that don't go to the dental office and they put it off or whatever, that gets scary, because you're like, okay, I avoided this, and now you're telling me I owe X amount of dollars, and I think it's overwhelming.
Well, let me ask you this then. So when you come out of school, obviously they teach you how to extract teeth and do that, I guess, preventative measure from it getting worse. But owning your own place,
Yeah.
Now, do you sit there and tell them, not what you should have done, but more, here's your options now. If I extract this, we're going into an implant.
It doesn't help for me to be, back when.
Oh, I like the way you made
ago,
that face, that Yogi Bear voice that came out. That's
how I talk when I'm serious.
I noticed that you got your shoulders up and everything. You were all like stern about it. Go on.
But I would never tell them like, this is what you should have done, because what's that going to do? It doesn't do anything.
You don't like to shame patients?
No, not at all. So it's like, okay, now what do we do to move forward and make this better? So, so we just I like to focus on the now and how we can improve now versus going backwards and talking about like what you should have done, because, whatever, that doesn't help.
You're not a big person, so I don't think you could get that stern. Like, you're only like 5 foot tall, so I wouldn't be that intimidated.
I'm very tall for my size.
Yeah. I mean, I think I would totally brush that off where you're like, okay, I get it. You're telling me I did this wrong. I get it. Thanks, Mom. But as far as when somebody's there, is there a different option? If it comes to the point that they need an extraction, that they have to go, they're kind of setting themselves up for a dental implant or long-term, whether it's dentures or however.
Yeah, there's options.
But you're going to kind of map each person out separately, right?
Yeah. So, I mean, I ask them what they want, because not everyone wants the same thing. So maybe they don't want to replace that tooth right away. Maybe they have something else they want to address, So that's what we call their chief concern. So we address what they really are, what is bothering them the most. Then I make suggestions on like, for example, but you're talking about like if they're missing a tooth. So there's options. You can get a bridge, you can get an implant, you can get a removable denture. I mean, all these things, it just depends on what they want and how much they want to spend on it. But I will say, though, if you choose one thing, it doesn't mean that you're stuck with it forever. So say you couldn't afford an implant right now and you did a removable denture. That doesn't mean you can't do that implant later. So I don't want anyone to ever feel like they're stuck with that decision just because that's what they could do at the moment.
But do you think it's more, you're very in the new age of this digital technology, the experiences I've heard from other people, I actually went to a dentist for a while. That it didn't happen to me, but I happen to know somebody that worked there that I was married to, and we don't have to bring that up, but I always thought it was kind of odd that he was constantly looking to make revenue because he had an expensive building, like it looked like a salon.
Sure.
So it was, that tooth's got to come out, and then we're going to put this implant in, we're going to do this and this and this, and it was more, how much could I make off of this? Because the biggest thing was, you've got great dental insurance, which I don't think is really a compliment. I don't think that's the thing you want to hear right off the rip. But
no, and I think that's really off-putting, and I've heard a lot of patients actually say that, and I'm never focused on their insurance. I actually don't know a lot about dental insurance. I let Ellen take care of that. It's just I address what they want me to address, and then if they're not ready, they're not ready. So
right.
But I just say, I'm here when you're ready to do or fix this or do whatever you need to do. So it's not, for me, it's not urgent unless I like my patients to kind of drive the situation because it's their mouth. They get to choose. It's not my choice.
Right. And this wasn't, I didn't want you to have to tell people you're an insurance expert or like you're running their credit card all day. It was more, this article was kind of timely because I thought, how many American people don't realize, number one, that you don't have dental insurance? Like for me, I don't have dental insurance, so I have to pay out of pocket or I have to marry another hygienist. So one way or another.
Or make friends with a dentist.
Who wants to be friends with a dentist?
No one.
I want to be friends with a dentist that's seen movies, I can tell you that. But the point of that being that I have options. There are a lot of people, a lot of households under $23,000, they have children.
Yeah.
So you've got to take care of the children in your home before you kind of take care of your own. It would be selfish to be like, guys, I need to get a partial so no one's eating around here for a few months. You know what I mean?
Right.
So I thought it was something to address because, again, if 1 in 5 people that are 65 and older are having teeth extracted and not on an insurance-based thing, I thought it was such a big topic to talk about. You don't have to be an expert in insurance to know that's bad. No,
it's terrible. But I do want to say, though, in our office, we do offer for people that don't have insurance, I think it's an in-house benefit program. So you just pay an annual fee, and then you get your 2 cleanings, your preventative care package, essentially. And then you get a discount on any work that you need to have done. So it actually ends up being probably what you would pay for dental insurance anyway, but at least you're getting that preventative care so that we're watching, and seeing and hopefully not letting things develop further than they have to.
And in that situation, if someone's on a plan, so they've kind of done an in-house plan with you, they know the next steps. It's kind of like they have a roadmap for, we're going to do this extraction or whatever it may be. Here's your 4 to 6 to 8 month, whatever plan. So they're kind of in it with you.
Yeah. We have a treatment plan, and then we put in phases, I guess what you would call it. And I prioritize it too. So sometimes I address what they want, but then they'll say, well, what do you think? And I'll take care of active cavities, decay, infection. You take care of that first. And then you do more of the strength stuff or the aesthetic stuff much later. Because
the aesthetic stuff,
like
a gold tooth.
Yeah, like the grill.
Is that still a thing? Do people still get grills?
I don't make them, but I think some people do.
You could make a grill.
I could.
That would be awesome.
Do you want a grill?
I want to. No, I want you to have one that says "Ping" across the front. Remember LL Cool J? LL Cool J, before he was an actor, was a rapper. I don't know if anyone listening or this, but like everybody had grills.
I didn't watch 16 Candles. I don't know who LL Cool J is.
And on that note, we're going to take a break, and I'm going to fill you in on 16 Candles. You are listening to the River Park Dental Show.
Hi, I'm Dr. Phing Saurer, owner of River Park Dental. My team and I provide tongue and lip tie releases with a CO2 laser for babies struggling to nurse. We understand how stressful this can be. To make it easier for you, we bill our fee to most medical insurances. That way you can focus your time on what's important, you and your baby. We are proud to be your local provider. To learn more, visit us at riverparkdental.com. River Park Dental, where we practice tomorrow's dentistry today.
Are you an outdoor person? Do you want to do creative work? Check out the job opportunities at Greenscapes Landscape Company. We are now hiring for our new Northwest location near Dublin. No experience necessary, just a great attitude. We offer great pay, health insurance, and a company matching 401k plan. Go to greenscapes.net for an online application or call Sandy at 614-837-1869. Greenscapes is an equal opportunity employer.
They say it doesn't matter if you win or lose as long as you tried your best. But they probably didn't just get crushed by a semi-tractor trailer. You lost when you were hit. You need to win to get your life back. I'm Scott Elliott Smith, and I have over 35 years of experience protecting families. You don't do what I do for very long if you're not successful helping families get back on their feet. Visit us online at sestriallaw.com. Get Scott Smith. Get justice.
I'm Dr. Phing Saurer, your dentist at Bridge Park. Have you ever been to a dental office and received bad news? Then you were told to see a different dentist with a different set of financial policies at an inconvenient location? At River Park Dental, once you become our patient, we won't ask you to see anyone else. My team and I are highly experienced and are proud to offer all services for you and your entire family under one roof. To learn more, visit us at riverparkdental.com. River Park Dental, where we practice tomorrow's dentistry today.
Hi, this is Jeff with Myers Jewelers. If you're in the market for an engagement ring and or wedding band, then let Myers Jewelers be your one-stop destination for this bridal season. At Myers Jewelers, we have teamed with some of the finest designers in the world. From Tacori to Hearts on Fire to Martin Flyer to Simon G, Sylvie, and many, many more. Along with our great selection of designer ring styles, we have a multi-million-dollar selection of certified loose diamonds as well. Come visit the family on Stringtown Road in Grove City and experience Myers Jewelers.
This is Jim Pack, CEO of Glencoe Equipment. Glencoe Equipment, located in Grove City, offers spring specials on early tune-ups for your outdoor power equipment. Whether it is your walk-behind, riding, Z-return, Glencoe offers a full tune-up on any of your equipment. Why wait for weeks and still overpay for your service? Come to the one place in Columbus you can trust for service and quality, Glencoe Equipment, a Kohler and Briggs & Stratton Warranty Center. Visit us at glencoeequip.com.
Prices and service listed may vary by equipment type and size. Visit glencoeequip.com.
This is Dr. Dan Reed, DC, at Mission Chiropractic and Wellness. If you are pregnant and strive for optimal health during pregnancy, labor, and post-birth, call us today. Mission Chiropractic specializes in chiropractic pregnancy care, and research shows chiropractic is the safest alternative for expecting mothers to improve discomfort during pregnancy and overall health outcomes for the mother and child. Schedule an appointment at our office. Call us at 614-559-8666 or get us online at getmissionchiropractic.com.
How's HouseTrends.com, the perfect place for you if you enjoy looking at beautiful homes and outdoor living spaces. Their stunning photos and articles focus on local Central Ohio residential building and remodeling projects with plenty of kitchen, bedroom, interior design, and landscaping ideas. You'll also discover exciting options in home design and furnishings. HouseTrends.com adds new content daily. Sign up to receive their online edition and check out past issues too. Go to HouseTrends.com and click on Columbus.
Hi, I'm Dr. Phing Saurer, your dentist at Bridge Park in Dublin, Ohio. If you aren't feeling confident and dream of a brighter smile, we can help. For $450, we can make your smile movie star white in just an hour in our office. Or we can make you custom fit trays and gel to take home for $125. If you need a quick solution, we offer pre-filled whitening trays that are just $30. A confident smile is on the way. We've got you covered. To learn more, visit us at riverparkdental.com. Welcome back to the River Park Dental Show. This is Dr. Phing Saurer.
Yeah, and you don't have to introduce me again. This is the second time around.
I didn't.
Hey, well, I kind of wish you did.
I paused.
Now, well, I wasn't sure what the pause was.
I was listening.
Listen, before we went to break, we were talking about Medicare coverage for the elderly, but also dental insurance in general. And again, just to recap, dental insurance is not covered by regular insurance. So it's either a benefit you get through work or you have to kind of do a health savings
and they
plan.
give a lot of different options too.
Well, it's kind of like when you buy car insurance. You get car insurance and they'll sell you the minimum, but if you ask for things like umbrella coverage or anything like that, they can add it on and price it out for you. But if you don't ask, a lot of times they're not going to even mention it.
That's true. And I would recommend people ask, because I think a lot of times they come in and they're like, oh yeah, I have this insurance. And then we're like, well, your employer picked the lowest possible coverage, you know.
Yeah, employers are always really looking out for your health. They really like it when you...
I look out for the health.
You do this. Wait, I think this is the perfect time to bring this up.
What?
So you hired a new hygienist, right?
No, dental assistant.
What is the difference? Oh, wait, I know the difference. I was
married to a hygienist.
I dated a dental assistant once.
What are you, like?
I just really like health-related things. All right?
You're a dentist. Yeah.
I went to the dentist a lot. More than a bar. I just like, hey, you look like you're good with hands and you do a lot of cool things and I could get free floss. But that's not the point of the show today. You're getting me off track. What was I saying? Oh.
My dental assistant, yes.
Yes. So you guys did a little video yesterday.
Oh, yeah.
What were you celebrating? Just that you hired somebody?
Yeah. And that it was rainy. The weather was just the Ohio weather. So we just wanted to do something fun.
Okay.
But yeah. Yeah, no, Sarah is amazing. We love her and we just wanted to welcome her.
But she's new, right?
Yeah.
So you love her already. That's kind of like, I'm so in love. I can't wait. And then you get married and you're like, pick up these towels.
I can tell right away if someone's good. And she's good.
Really? Okay.
Mm-hmm. I'm magical like that.
All right. Well, I thought that was a big announcement. And then also, you're going to be on TV in the next couple of weeks. I don't know if you know that.
What?
For your 40 under 40. Ellen was mentioning it. We need to get you on TV, so we're going to work that out.
Oh, gosh.
But again, if somebody didn't listen to the first show, being that you're 40 under 40, and this has nothing to do with
definitely
insurance.
under 40.
Okay, well, you're pushing it. But what is the 40 under 40? What did you win?
Nothing, but
well, you're going to be on a magazine. You're going to be all dolled up.
Yes, I'm going to be on a magazine. I fly out to New York City. There's a photo shoot and a stylist and a glam squad and all that fun stuff. And I get an interview and I get to meet the other dentists. And
but it's a very exclusive club. I mean, this is
there's
across
only 40
the nation.
of us.
You didn't win
country.
40 out of 40 in Columbus. I mean, there's probably only 60 dentists, right? So that's not as impressive.
There's more than 60 dentists in Columbus.
Not that I've been to. I'm just pointing that out. So I'm sorry if I do like to get around to dental offices. So you won this, and what was the name of the magazine? Because I'm going to get this wrong. I wanted to say it was
Incisal Edge.
I almost called it Invictus, which I think is some kind of mud running race. So
I would. Yeah, that actually. That would be
you're
better.
going off topic. It would be cool if the dentist.
If
that's
40
how you
under
won.
40 in Invictus.
Yeah, that would be a really cool thing. But
who can do the fastest root canal? Who can do the? Are you talking about like?
I feel like you're going to try to do that now. Like I feel like you're going to try to race through it, like you're timing it in case there isn't a work.
It's not a race unless I'm winning. Man, it's
so much for the patient. What I wanted to talk about in the remaining time that we're not talking about mud running races was we talked about if you didn't have dental insurance and you've got a family. what do you look at? And I'm just saying this because you're a mom, you have children. If you didn't have dental insurance, how do you prioritize your family? Because you're married, you have kids.
I've seen it. I mean, the moms and dads will always put their kids first. So the kids get the checkups first. And usually it's actually mom or dad. It depends on which one. They'll be one of the two will be the last. And then they just put all the money towards the one that needs it the most. With kids, though, I think parents are pretty good about being preventative with kids because they know, because it's hard, if your child has a cavity and then they have to get numb and they're all scared of the dentist and the needle and all that stuff. And which we do use the laser.
Right, so you're not the scary dentist pulling out that huge, like rocket size.
I think
needle.
I'm their size too, at their level.
That's got to be nice. It's kind of like when you see the Ewoks in Return of the Jedi, you're like, oh, this is a friendly thing.
Yeah.
You should compare yourself to
Ewoks.
Kids. Yeah.
Okay.
Like if you see a kid and you're like, I know
maybe.
you're scared, but if you thought of Ewoks, I'm like, I've only seen the new movies, and you realize they're only like 5. You got to drop that. Maybe go to 16 Candles.
They're not going to know. I don't know. Kids?
No, they would not know that movie.
No.
But they would know
I'm
Star
at the same
Wars.
level as they are.
Maybe a porg. I think that's what it's called, the porgs. Those little midgety things.
What?
See a movie. But let's get back to this. So you got kids in there. So the parents prioritize the children. So do you have a plan, the same thing, kind of like a savings benefit plan for them? Because you said you had that for an individual, if someone came in and needed work done and didn't have insurance.
Yeah.
Do you do the same thing for kids?
Yeah, absolutely. Yeah. And that's the thing that we definitely try to promote because it's, like I said, preventative is the best thing you can do for your kids. And then if we can catch things early, and then I think too, if they get into that habit and they become adults, they'll seek out that dental care or make sure they have their dental insurance, and not just say, well, I didn't know this was even a thing, and they might go be that adult and then waits 10 years before they see a dentist.
Right.
So I always like to start them when they're young and just kind of let them know the process. And, I always say too, start them at 2, have them come in, even if it's a ride in the chair, at least they know that, okay, this is where you get your teeth cleaned. And they watch their mom and dad get their teeth cleaned or their older brother or sister or, someone. And they know that it's fun and it's not a scary thing.
Right. In the last couple of minutes that we have, I wanted to ask you, I'm curious, you've been in dentistry a long time, but River Park is a newer facility that you own.
Yeah.
What's the bulk that you're seeing right now? Is it mainly families or is it kids or I know
families? Yeah.
And there are people that are coming to you. I mean, they're coming to you because of the technology or just because it's you?
I doubt it's because of me, but people have said they come because of the comprehensive care. So they don't like so if they do need an extraction or an implant, I don't tell them to go to an oral surgeon or whoever else.
Oh, that's right. Because it can all be done in the same place.
So it's all done under the same in the same place. Yeah. So then they hate having to go to different places and maybe they don't accept insurance. So then there's another issue with dental insurance and all that stuff.
We should do a show on that.
Yeah. So they like that aspect. And I think the technology is cool too. But the convenience, and it's nice. It's fun. We like to make it's like you saw that dancing video. We like to have fun.
What was the first dancing video I've ever seen in a dental office? I will say that.
Do you look for many videos with dentists dancing? I mean, my moves
I look for a lot of. First of all, I'm going to say this: when the last minute we have left to go, you were a little stiff in the hips. So I would loosen up a little bit, but everybody else,
the black scrubs made me a little.
No, I think you're thinking of what makes you look bigger on TV or smaller is colors, not dancing. But again, for the first dancing dentist I've seen on Instagram, it was fantastic.
Thanks, Mike.
And 40 under 40 should recognize that. That's going to be it for this week, Dr. Phing. And do you have any parting words of wisdom, or do you just want to say goodbye and then we'll see him next week?
Well, we will see you next week. And then also, if you want to come to my office, just visit us at 6605 Longshore Street, Dublin, Ohio.
Oh, the website website.
riverparkdental.com.
All right, that's it for this week. We'll see you next week.
Okay.
You've been listening to a Morris Media production.